Welcome back to the Arise interview. I'm Charles Enyekolu. Now, some of the largest refugee camps in West Africa are right here in Nigeria, where nearly 2 million displaced people are living. Aid agencies and civil society groups are warning that without proper internet and sanitation facilities, people in those camps have not been able to properly access vital information about the coronavirus, including basic hygiene tips. They don't appear to be any confirmed cases yet in those IDP camps, and NGOs are urging the Nigerian government to embark on a widespread drive now to raise awareness of COVID-19 in refugee and IDP camps, everything from teaching people to sneeze correctly to the provision of lots of water and hand sanitizers.
These refugees are often packed very tightly into camps, and that makes a big difference to transmission. The access, of course, to water, sanitation and hygiene makes a big difference, and also just their general nutritional state. They're in a huge state of stress anyway, which suppresses their immune systems. Of course, many refugees, and particularly internally displaced populations, live in makeshift camps very far away from any sort of external official help. And those are the ones that are really very, very vulnerable.
Well, for more on this, I'm joined now in the studio by Mona Audu, Chairperson of the Mona Audu Foundation, an NGO that works periodically in IDP camps in Nigeria. Thank you very much indeed for coming in.
Thank you for having me.
First of all, tell us about your foundation and what you're doing.
Well, the Mona Audu Foundation, at the moment, with regards to COVID-19, is going around giving free food to the most vulnerable in our society, not just the IDP camps, but basically the satellite towns. We've been in Lagos, Abuja, Kogi, and Ogun State. We're hoping to spread into more states across Nigeria.
And you obviously see a need to do that because there's a gap to be filled.
Well, there definitely is a gap to be filled, and the impromptu nature of how this, cropped up on everyone means that a lot of people did not have time to prepare themselves for the lockdown, obviously to help the government and make it easier for people to stay at home. We're going around giving out care packs that basically include, rice, semovita, spaghetti, noodles, and all the basic stuff that you need to at least eat and stay at home and stay safe.
But obviously that's just scratching the surface.
It is, honestly, it really is. But the thing is, for me, I just feel like how, as opposed to sitting at home and doing nothing, you need to start so people believe in what you're doing and show them that you can actually do the right thing. We have started, we have reached out to the necessary ministries, parastatals, etc., to let them know this is what we're doing, and we're going to keep doing this to the best of our capacity. But if you do decide to do this through us, we also have a very vast network of volunteers, all volunteers across the country who are willing to go community by community and distribute these food items to people's doors as opposed to bringing them out in crowd.
Well, let's talk about the main thrust of our interview, which is the state of affairs in the IDP camps, the internally displaced persons camp. Right. There's a lot of concern internationally. Doctors Without Borders, Médecins Sans Frontières, and so on, have been raising a lot of warnings, issuing warnings about the fact that these IDP camps are not getting the necessary information. The way they are built, they're constructed, makes it very difficult for them to remain safe. How essential is it to share health warnings about the coronavirus with people in the IDP camps in Nigeria? Because your organization works in those camps as well, don't
we? We haven't been since the COVID-19 breakout. The main reason is because the government has spoken about giving them 2 months feeding allowance, which they've been giving to them. So we believe that we had other vulnerable Nigerians who are not even documented. So we started from that angle. But personally, I have been to one of the IDP camps in Area 11, and it's actually I've been to 2 actually, one after the Apo Mechanical Village.
That's
and
in
then
Abuja,
there's another one in Durumi, yes,
right,
here in Abuja. And for me, even before all of this started, the environment isn't habitable, to put it nicely. When I went with a group, my foundation went to support a beauty pageantry, and one of the things we did was go around the IDPs and give exactly the same thing we're doing now, food supplies and basic household necessities. And one of the things we found when we were there was that we didn't actually find any healthcare clinics or any mode of like, say for instance, they fell sick, we weren't sure how they were being treated. And we didn't go there to identify the weaknesses, but also we just figured that we asked a lot of questions just to see what they needed. And one of the things they discussed was the fact that how, say for instance, a child was sick or a mother was about to go into delivery, they didn't have access to healthcare within the IDP camps. They had to go obviously back into town. And considering the fact that how a lot of the cities are on lockdown now, it's important to readdress that. It might have been okay previously to travel for treatment, but now it's better to contain or at least to manage the illnesses within, especially if it's not COVID-19 related, because it might just be basic illnesses, and then you take them into a hospital and then they come back out and they've been exposed to the cities because this is where the viruses are, that this seems to be the origin of them, and then they go back. And one of the things we also noticed, which obviously is part of the nature of an IDP camp, is the fact that it's they're like makeshift homes. They're not well structured, and then also they're heavily overpopulated.
Well, I was just going to say that the people in those camps, and they gather together, don't they? I mean, for meals, for provisions to be distributed,
for everything.
And all that sort
They're
of thing.
always together. They sleep. The sleeping pattern is.
So the idea of social distancing is
it's impossible because especially when you take it back to how would they sleep. I mean, in the daytime, because it's on the outskirts, there's a bit of land. You can decide to sit on your own or whatever under a tree, which is it's very basic. But at night, when they have to go back and sleep, the sleeping arrangement is horrendous for this kind of situation. So it's imperative that we look at that. And for me, one of my concerns is we need to be realistic. In Nigeria, the virus seems to be spreading more amongst the elite in our society, and these are the people who tend to visit at this time, critical time, who would be visiting the IDP camps. It's imperative that maybe we find another method of getting this message to them.
Right, because I was going to ask you, I mean, how NGOs like your own would cope with the things they normally do in those camps in light of the coronavirus. Are they suspending all but essential services in order to limit social contact and the spread of the virus there?
Personally, I'm working actively now with like about 4 or 5 NGOs locally. In Abuja, if we're talking about Abuja, and then more in other states. And what I've found is that because we've heard from the federal government that the IDP camps have been paid 2 months allowances to allow them feed, we have focused on the more vulnerable in our societies who don't seem to be, they're not in anyone's plan. So we started from that and then we're working backwards. But it's also very important that awareness more than anything else. It's one thing to give them some money to take care of themselves and to feed, but it's also very necessary to, improve their hygiene. Hygiene is a big problem. And even if you do improve the hygiene, where do we start from with their living arrangements at the moment? Because that also is a big problem. You find a mother with 4 or 5 children and she has a little spot.
Yeah, but what are people like you? Because obviously you're speaking very articulately about this. You're clearly aware of what is going on. I mean, what do you suggest is what should be done so they can maintain distance? I mean, as you said, they live in cramped quarters, several people often sharing very tight spaces. I mean, what's your recommendation?
Well, we've seen very recently that how it's possible to put up more tent-like accommodation very quickly. I think we should consider doing that. Just like we're setting up isolation centers very, very quickly, I think we should consider doing that, because the way they're living, I mean, if one person in that camp gets it, it's disaster. It's bound to spread like wildfire because the distance, there is no room for social distancing.
So in addition to the fact that they don't live, I mean, they live in very cramped quarters, the fact that they're not being educated at the moment on what social distancing means, and they don't even have enough water, from what I understand, to wash their hands and so on and so forth. You're also concerned about how the healthcare system itself will cope if these things happen in those
Exactly.
camps.
Another problem is they actually have water pumps, because I've seen like the one I went to, like I said, on the outskirts of Akpo after the mechanical village, they had like 4 water pumps, but the problem is there's no generators to pump the water, and there isn't regular supply of power, so it defeats the purpose. So yes, you can pump water, but there's no power to pump it. So that has to be looked into. We need to make sure that they have power supply, and this is just one location. I bet you there's some locations that do not even have the ability to pump the water, but I'm only speaking based on the ones I've seen personally.
Well, I mean, the fact is that, and that's a good point you're making there, because I mean, here you are in Abuja, which is the capital, and is considered the most modern city in Nigeria. I mean, if you then go to places like Borno State, which is the epicenter of the Boko Haram insurgency, in some of the remote areas, I mean, which at the best of times don't have any facilities. I just imagine what those places are going to be like.
You'll be very surprised what Borno State looks like. I want to be very honest with you, because originally my family is from Borno State, and I've been a few times, and it's extreme. It's Borno State in terms of development, and forgetting the insecurity, is as developed as Abuja. The governor's doing extremely well.
No, but I mean, like people in far-flung villages and things where you would normally have very few facilities, electricity, all that.
But that's what I'm saying.
Which is the same across Nigeria.
The road network in Borno State is one of the best. It's weird. It's really weird. It's not explainable unless you've been there. I don't think the situation in Abuja, especially for the IDPs, is any better than it is in Borno. I think Borno may even be slightly better, because a lot of people actually run away from Borno particularly, and that means that they have fewer people. Abuja is way overcrowded. People by choice, if they had a choice to be in Borno or to be in Abuja, would come to Abuja thinking that they would get access to more, being closer to the capital. But that hasn't been the case. And the governor in Borno State is doing exceptionally well.
Yeah, but the interesting thing is that all the concern that's been raised by international aid agencies, by local aid agencies, has been about Borno State. Their main focus has been the number of displaced people who are in that area, the northeast.
That's
and
right,
how
but
they
that's
can cope.
also because of the media. A lot of the time, a lot of the stories, the media generally circulates about Nigeria. If you don't live in Nigeria, you don't know.
I mean, you're not being defensive.
No, I'm not.
There,
I'm not actually. No, it has nothing to do with that.
Right.
I feel as much at home in Abuja as I would do in Maiduguri, to be honest with you, or whatever. But if we want to be factual, a lot of it is people are not speaking from first-hand knowledge. They're speaking based on what they perceive. Oh, there's Boko Haram.
Okay,
so
well, let's finish this chat in a minute, because I must take a break. You're watching the Arise interview. Plenty more still ahead as we continue our chat about the threat of the coronavirus in IDP camps. Stay with us. Welcome back to the Arise interview. I'm Charles Aniagolo. Now, aid agencies and civil society groups in Nigeria are calling for urgent and immediate improvement in water and sanitation facilities in all the internally displaced persons camps in the country. They're warning that an outbreak of the coronavirus in the camps would be devastating because of overcrowding and poor sanitary conditions. A statement released by the NGO Doctors Without Borders warned that after more than a decade of armed conflict, outbreaks of severe malnutrition, malaria, measles, and cholera, approximately 1.5 million internally displaced people in places like Borno State in the northeast now face the specter of COVID-19. It said that many live in vastly overcrowded camps with poor water and sanitation facilities, limited supplies of hygiene essentials such as soap and water, and often no individual space at all. Doctors Without Borders also noted that functioning health facilities, particularly in Borno State, are scarce, and the capacity to refer patients is extremely limited. With me in the studio, Zara Mustafa Audu, Chairperson of the Mona Audu Foundation, an NGO that works in IDP camps in Nigeria. Thank you for staying with us.
Thank you for having me.
And what is your sense of those health facilities in places? Because, I mean, these are Doctors Without Borders, and their job is to go around and provide healthcare services to remote places.
like what I said, from the IDP camps I visited personally, I did not see any presence, any medical presence. But obviously that was pre COVID-19.
Right.
So I do not know at the moment if we've had any changes, but when I did go last year, there was no medical presence. I even spoke to a few mothers who complained about women going into delivery and having to be rushed into nearby centers or nearby communities for healthcare. So
in some ways, those IDP camps are cut off from the rest
They are.
of the country.
You literally, drive, you get to like the road stops and then it begins to be like an untarred road and then you drive further in and then that's it. So it's completely makeshift. It's like just clearing a patch in the bush
almost like
somewhere.
they're some kind of diseased people who must be kept away from the rest of the populace.
Completely cut off from society, to be honest with you. And for me, the fact that it's been there for that long, you'd wonder why the living condition has stayed the same. If it was makeshift for like a month or 2 months or a year, then yes, you would understand. But I mean, it seems to be ongoing.
But are these things that, NGOs like yours, are these issues that they raise with the government, in public enlightenment? You're obviously doing that now. You're sitting here in a media sort of organization and talking to a lot of people. But do you people sort of raise those things and say, well, these are our observations and we recommend this, that, and the other thing?
For me, I am part of quite a few civil society group organizations, and yes, we have. But we have raised issues as a group, and I have raised issues personally. I've been on majority of the networks and radios and spoken and newspaper articles and all of that. And I feel like how, in all honesty, to some extent, our government does have its hands full. If we look at the full scope of things, if you take entire Nigeria as a whole, all the demands from this angle and that angle, so we can't solely depend on the government. I think we also need to look inwards into corporate social responsibility.
That's a good point.
I mean, for me, with the NGO, I have a lot of other personal businesses, but this is my corporate social responsibility to help and give back to the society which I live in, because a break in Nigeria is a direct, I directly suffer.
Yeah.
So for that reason, I feel like and then I also feel like, especially during this period, a lot of people donating directly to the government should take up the initiative of actually going to these IDP camps and doing something. You don't need to give them money. You can decide to rehabilitate the place, renovate the place. You can sponsor training and education for these people, like you said. Basic healthcare, basic hygiene, this is something they don't even have on a day-to-day basis. Half of them do not have soap. They never have soap to shower. So you taking soap in there is a luxury.
But of course, people would argue that, at the best of times across Nigeria, particularly in rural areas, they don't have healthcare facilities anyway.
This is our story, but then every situation creates an opportunity for change. That's the way I look at it. I even going around feeding the most vulnerable in our society, these people have always existed. But me having the time right now to focus on them, I'm making the most of that time. I'm not at work, so I can do this. So we shouldn't just brush it off and say it's always been there. Yes, it's always been there, but everything that has a beginning has an end. How about we try and bring this to an end? How about if we see COVID-19 as a wake-up call to make things better? There's nothing has to go on indefinitely, especially when it's something negative. Come on, even positive things don't run forever. So how much more, the negatives.
Sure.
So,
but given what you're going to be visiting the camps again, I think later this week,
yes.
or something like that. I mean, are you currently getting information about what's going on inside the camps presently? Are there any concerns of any news that possibly COVID-19 is sort of in there or hovering around the place?
Honestly, to be very honest with you, I feel, and this again is not factual, but this is my opinion, I feel like they're ignorant. I feel like they don't even believe it. I feel a lot of them feel like, it's something that only affects the elite in the society. It's confused with religion, believing that, I don't know, but I feel
so there is ignorance.
It's basically ignorance. A lot of people don't believe it. And again, until they see it affect one or two people, it's, the message is not going to sink in. It's just people coming and speaking English or people coming and doing what they can do and leaving them to their faith, because that's what it is. We go there, we do the little we can, and we go back home. So we leave them to their fate. So every time they see us, yeah, for a minute they're happy because they're more interested in what we've brought as opposed to the message we're delivering. If we're going there just simply to say, oh, wash your hands and, you know, social distancing, and nobody's listening.
Yeah, so somebody has to take charge of it.
They're sitting down to listen only when there's goodie bags at the end or care packs or, you know, there's something you're giving back. If there's nothing you're giving back, half of them are not interested. Don't forget, a lot of them don't even speak English, so we have to do a lot of speaking in the local dialects in Hausa and Yoruba, mainly Yoruba. I haven't really seen Igbo people there, to be honest, so more of Hausa and Yoruba, you know, and Fulani language and Kanuri and all of that. So it's more of what did you bring as opposed to what do you have to say.
So what is particularly concerning from your point of view is the fact also that nutrition is very poor in those camps.
Nutrition is poor,
which means that immune systems will automatically be weakened
and
as a result.
hygiene is poor on a good day.
But obviously if you're not eating properly, then your immune system is automatically weakened in any case, and makes it much more difficult to resist such a powerful virus such as COVID-19.
Absolutely, and it's not just the immune system, it's also, again, like I said, the population. One gets it, like 100 will get it the next day, literally. Well, I'm not a doctor, but I feel that way because the proximity to each other is just too close. Their kids, the way the kids play, and then again, hygiene, they do not have the habit of showering regularly, even on a good day, talk less of washing their hands. Like,
so what would you suggest, because we're running out of time, what would you say to the government now? I mean, which government department? Is it the Ministry of Humanitarian
Yes,
Affairs?
It is
and that sort of thing?
It depends. Well, it's two people. It's the Ministry of Humanitarian Affairs for the entire country. It's also, they have, there's the ministry, or is it the organization for migrants, IDP, internally displaced people. And then, of course, in the FCT, it would be the FCT administration. In every other state, it would be the governor. We need to educate these people. We need to look inwards and actually make the living standard more comfortable for them.
I want to thank you very much indeed, Zara Mustafa Audu, Chairperson of the Mona Audu Foundation. Thank you.
Thank you so much for having me.
That's it for this edition of the Arise interview. Join us again tomorrow from me and the entire team here in Abuja. Bye-bye, and thank you for watching.